Thanks, Mel. So welcome, good afternoon, and thank you all so much for joining us today. I'm Ann Gaasch, the CEO here at FamilyWise, and I'm happy to have the chance to share news and updates with you. I'm also very excited that we have Emily Clary with us today. Emily is our Senior Director of Prevention Initiatives. She oversees our near and tribal near communities programs, which have grown in many ways in recent years. She also led planning for our annual Growing Resilient Communities Gathering, which took place last month. And in a few minutes, I'm going to ask Emily to share some highlights from these programs and give you a chance to ask some questions about some of her updates that she shares, or any questions you have, actually. But I want to start out by talking about, since our last conversation in March, we have held two big events. In April, we hosted our annual fundraiser for family well-being, which brought together more than 100 people and raised over $22,000 to support Minnesota children and families. It was a really fun night, and we are so appreciative of the supporters that joined us and the sponsors that helped make the event possible.
And I think we lost your audio for a minute. I'm curious if anyone else is having trouble hearing Ann.
I'm not able to hear Ann.
All right, is this any better? Okay. Somehow switched microphones on me, so. Emily, can you give me a hint as to where I cut out?
I think you were just giving that kind of that highlight about the family, the in-person event that we held.
Wonderful. So yes, we had an amazing event. It was a really fun evening, and we're just really grateful for everyone that helped make the event possible. And then last month in May, we held our Growing Resilient Communities Gathering, which is a virtual conference centered on preventing ACEs, or adverse childhood experiences, in our communities. The focus of this year's event was early childhood education, and we'll talk more about it with Emily in a moment. For now, I'd just like to say that the event was a big success, with 295 attendees joining us from across the state. Kudos to Emily and her team for putting together such a meaningful event. And if you missed it, you can find an event recap and session recordings on our website. So you have not completely missed out on it. And then next month, we're going to be launching a new event series that we're calling Pastries for Parents. These bi-monthly breakfasts will provide an opportunity for people unfamiliar with FamilyWise to come to our office in Minneapolis to learn more directly from our staff and participants. We look forward to making new connections with businesses and community members over donuts, croissants, babka, and other breakfast treats. In other agency news, I'm excited to share about some new partnerships that we have been developing over the past few months. First, we're really excited to be bringing partners together from Help Me Connect, the Minnesota Department of Health, and 2060 Digital of Hubbard Broadcasting in the creation of a public awareness campaign. The campaign will help Minnesota parents find parenting resources like parenting classes, parent mentoring programs, childcare, and early childhood education programs, and more through Help Me Connect, which is a truly amazing resource if you've never looked at it. We're excited that the campaign should launch next month, and we're preparing for the campaign. It's been a great opportunity for us and for other partners involved. We're also excited to announce that we're growing our partnership with Peacemaker Resources, located in Bemidji, who will begin facilitating our Tribal Near project in partnership with us. Lindsay McMurrin, Executive Director of Peacemaker Resources, has been a respected leader and a longtime thought partner and innovator in growing awareness of near science and building self-healing, particularly in tribal communities. And we're really excited to see what the future brings as we work in partnership with Lindsay and her team. And then this spring, lastly, an announcement about update partnerships. We invited 2 new members onto our board of directors. We're excited that we welcome Joanna Woolman and Stacy Rude. Joanna is the Executive Director of Keeping Families Connected Minnesota and a professor of law at Mitchell-Hamlin School of Law. She led the Institute to Transform Child Protection from 2016 to 2024, which is an organization focused on child welfare and trauma-responsive legal practice. And Stacy Rude is an executive at Aetna, where she leads care management programs serving individuals with complex medical and mental health needs. With more than 25 years of healthcare leadership, she has worked to improve access, equity, and quality of care for individuals and families. We are continuing to recruit members to our board, and you can learn more about that opportunity at Hands On Twin Cities. Operationally, it's been an interesting few months as we're undergoing a complex change from one vendor to another for our financial services. We are working on an interim basis with a consulting company called MMC, but we expect that we'll be sharing an RFP for financial services soon. If you happen to have suggestions for vendors to include on our list, please let me know. And then a last update that I want to share is that we recently hired a mentor specialist for our Bright Beginnings Young Parent Program. And we're really excited to welcome Nisha. She served as an intern in that program for the last few months. We're excited that this means we will have more capacity for and will be recruiting mentors. Mentors create lifelong relationships with young parents and their children, as well as providing concrete support. We support the mentor relationship formally for 1 year, but we've seen many relationships last on an ongoing basis over the lifetime for children and their families. We're hopeful that we are going to be able to include more mentors, including dads, so that we can connect youth who are involved in the justice system. We've been working with young parents in corrections in Hennepin County for several years, and we're seeing some incredible results. In 2023, 75% of the youth that we worked with did not reoffend, and 99% of those youth are still living in community. And speaking of kind of those connected parents, we're also excited to announce that the demand for our Circle of Parents facilitator trainings has been growing. We actually have run out of space in our online learning platform and have had to increase the number of spots to make sure that there's availability for new facilitators interested in participating in the training. So there's been a lot of great partnership work happening. And to continue to talk about it and to talk about more in depth about some of our prevention work, I'd like to invite Emily to join me. Emily, as I said before, is our Senior Director of Prevention Initiatives, and she's been doing this work in our community for a number of years. So welcome, Emily.
Thank you. It's really good to be here and to see many familiar faces in the room. So glad to be here.
Great. So Emily, can you give us because I think sometimes people are like, NEAR, what does that mean? Can you give us a brief overview of our NEAR community's work and why we share about NEAR science across all of our prevention programs?
Yes. So I just wanted to put in the chat, just for those of you who may be more kind of prefer to look at the text, I wanted to kind of break down very briefly so we can kind of get into more of the work, just what NEAR science is, why we talk about it, because our team knows how jargony it can sound. But really NEAR science is about, how experiences impact our biology, the health of future generations, long-term health, and what we can do about it. And so that's really what we believe that it's kind of an important first step to really thinking about how do we create the collective impact and community change we want to see, where all children and families can thrive in our communities. And so we kind of start here with the NEAR science education. And it kind of showed up a little bit goofy in the chat, but this is really the kind of a high level, quick overview of a summary of what each of those letters in that acronym mean. And I also know that we have some others who present on NEAR science in the room. So if anyone, again, as we're talking, wants to add information, a big part of this work is about honoring the wisdom of others in the room. So that's kind of why we talk about it, because we believe that the deeper work kind of happens once we all have this shared and common language and understanding about what we really need to do is to prevent ACEs from happening and support and kind of promote healing for those who may have already experienced ACEs and promote those protective factors so that each of us have really kind of a more equitable way and a healthy start to life and just a healthier long-term trajectory in our communities, for lack of a better word. So yeah, so that's a little bit about why we believe it matters, because I think all of us, I know many people on the call really are working towards creating more equitable communities, and what it takes to get there is to really address ACEs and reduce ACEs so we can promote long-term health and well-being in our communities.
That's a great explanation. I love how you talk about like the shared language as being a foundation for us to be able to start to prevent ACEs and to create communities that are able to kind of heal and support families in healing. And so from that, like at some point along the way, the gathering kind of sprung out of that. Can you talk about the gathering and how you've seen it evolve over the past few years?
Yeah, so that I will just kind of call out Ann Borth is in the room, and she has been a key partner since the beginning of the kind of us growing what the gathering is today. So we've had 8 gatherings over the years. This was our 8th year, as Ann talked about earlier during the call, and it has been really cool to see kind of how it's evolved. Really, the kind of the main goal of the gathering has been to kind of highlight some of the local efforts across Minnesota. Lowell has been featured in our presentations too. He's in the room, but kind of highlight the wonderful work that is already happening across the state of Minnesota to to reduce ACEs, to promote protective factors, to share information about neuroscience across the state. And so we really are trying to highlight both some of the researchers that are kind of as the field evolves of neuroscience is continually evolving, to kind of highlight the new research as it comes out, and also to highlight those community voices and stories. And I could go on and on, but this has been just a really cool event every year. We kind of have a chance to pull together, figure out what are some of the trends that we're seeing in our community, what are some of the trends we learned from our last year's gathering survey, and then we've really adapted, or kind of what is the work that we're currently engaging in that we want to highlight that's already happening across the state. So really trying to lift up and like share the stories and the voices of some of our partners that we get to work with every day. And it really, so kind of in short, it's a free event. We have those recordings that I believe Mel already posted in the chat. We invite you to take a look at kind of any of the past gatherings. I think we have at least 3 or 4 years on our FamilyWise webpage. But really it's about kind of bringing together, especially our children's mental health and family services collaboratives and their partners that are these wonderful networks across the state, 89 across the whole state, who are multi-sector, cross-sector, who are all working on kind of coordinating systems of care within each of their communities across, often mental health, social services, school districts, juvenile justice in some cases. So I know I'm missing partners, and so please know that there's more information about collaboratives that we can share with you. And then also really honoring and recognizing tribal communities and some of the work that we're doing through our Tribal Near project. So really bringing those partners in and highlighting some of the stories from our tribal partners too, who are also engaging in approaches to address ACEs and promote protective factors. So it's just a cool event. I always love those days of showing up and kind of just seeing how the event rolls out and hearing the stories from our partners.
I think it is such an unusual kind of gathering. It's not a conference, it's a gathering. And I love that it lifts up those stories of hope and healing and resilience and talks it gives a forum for communities to talk about what's working. So that's always so exciting to me. And I think it's really fitting that it kind of starts and ends with a slideshow about joy, because it is a very joyous day. So, as you've talked about some of the neuroscience work, I know that over the past years, the team has really been working on adapting the curriculum for some different audiences, specifically some different professions. And this year, kind of the gathering focused on the work that has been done in the early childhood community. So can you talk a little bit about what was needed there? What have been some of the challenges, and, how are people receiving this information in that community?
Yeah, absolutely. So we've done a couple of kind of deeper dives into different sectors, and we have found that we've learned kind of over the years of holding the ACE interface license, which is really kind of how we share about neuroscience across the state. FamilyWise holds that license for the state of Minnesota. And so what we have been doing is, we can share the general curriculum with everybody. As we kind of go deeper and really customize it for different audiences, like the early childhood education sector, we've just found that it resonates better. We can use more specific examples for those different sectors that we've worked in. And so for the early childhood sector, one thing that we had a chance to partner with Greater Twin Cities United Way on this partnership. It's a 2-year partnership through kind of the 80 by 3 initiative which is really trying to kind of create more trauma responsive kind of systems within especially the metro, but across the state, to kind of support healthy beginnings. A lot of our missions kind of are very aligned. And so the way that they want to, like, kind of the strategy they're taking for that is to infuse this information across that sector. And we have previously shared this information with early childhood audiences, but we've had a harder time getting kind of it broadly spread throughout that sector, because we did not have an opportunity to really give out the developed learning hours that are needed for that sector in order to kind of earn those learning hours that are required each year, I believe, through the state of Minnesota. And so we went through kind of a process to get to become trainers of this content. And now FamilyWise is a training sponsor, or it's kind of a training organization within the developed system. So now we can reach many different childcare providers across the state. They'll earn those learning hours and they'll get access to the information. So it previously was a barrier. We are so excited that we have been able to partner with 80 by 3 in this. We've trained 27 people to go into their different sectors, or kind of into the early childhood sector across many of the different levels in the community, to share this information. We customize the content for early child care providers by bringing in kind of videos that were more specific to that, kind of those providers and some of the needs that they've shared with us. We kind of created a worksheet where people could kind of really take what we've been hearing from that group. Is we really want to hear, like, we want it to be really practical. We want to be able to bring it into our classrooms. And sometimes, like, the information is great, but not what do we do with it? So we've really tried to take some measures to have some kind of concrete tools people can walk away with after the presentation. So all of those things are what we've been working on kind of in partnership. It's not just our team sitting down and making, kind of devising all these materials. We're asking for feedback. We've been piloting. We did a roundtable with a bunch of early child care providers in August. We piloted 3 presentations with the content, kind of took the feedback and kind of kept tweaking the curriculum. And then we rolled it out in a training in February of this year. And now kind of 27 early child care providers have the curriculum that has been customized for the early child care sector. So just so many different opportunities that have really been shaped. Like, this whole curriculum and customized deck of slides has really been created in partnership with both internal FamilyWise staff who have that background in the early child care sector, and then also some of these wonderful presenters who we had a chance to train in February.
That's so exciting. And I see in the chat, Lowell mentioned the topic of moral distress, and, like, how can we build some connections with people who might be able to kind of have that conversation? So I don't know if you want anything you want to add now, Emily, or if that's just kind of a comment for the group, but I think that's a great point. It's so connected to kind of that sense of trauma. So I think it would be a really good thing for us to kind of be having those conversations and incorporating.
Yeah, well, I'd love to talk more. I saw you had another message for me, so maybe we could connect after to just kind of learn more about what you're looking for. Yeah, awesome.
And then, Emily, as you've talked about this, like, how do you think all this work in the early childhood sector might change things for families, or will change things for families?
Yeah, so I think some of the parts that we are kind of some of the work we're doing has been really focused on supporting the early child care providers so they can show up for children and families in a way and really understand some of the research of kind of why it matters kind of to be regulated, to be taking care of themselves. So I think part of it's really about promoting not just self-care, but like really promoting kind of people in this field who are working very hard in the early child care sector to care for themselves as well. Because, I think my colleague Lindsay used to, often says, like, self-care is community care. And we just know that there's a lot of turnover in the early child care sector. So part of it is really creating that more consistent kind of group of early child care providers in the state of Minnesota who are able to pass along some of this information to children and families when it may be, well, probably more families and caregivers, but like really trying to share some of this information in a developmentally appropriate way, responding to behaviors in classrooms, being able to kind of teach caregivers like, hey, I noticed that this might be a good strategy to try with your kid when they're maybe having a hard time or having big feelings, and really just being able to pass along this research and kind of dose it out in ways that really are responsive to what children and families may need in those moments. And they are really kind of, I have 2 kids in childcare, and they are a big part of my village is having these early childcare providers help me understand what is developmentally appropriate. How do I respond to when my kid has maybe a behavioral issue in the classroom? And so they are kind of one of the those key voices or pieces in the village. And so I think having them equipped with this information will kind of ripple out to families if they have some of that information that they can share. And for a lot of people we've already presented to this information to, they were not aware of this information or didn't have all the kind of the understanding of how it all connected. Maybe they'd learned about ACEs, but kind of putting it in the framework of, and there are things that we can do to really mitigate some of that harm or respond in ways that are more supportive. That all is kind of part of the approach that we're taking at FamilyWise.
And I think you're so right that early childhood providers are such a critical support for families and such a trusted partner. Sometimes maybe when families are feeling isolated or alone, or they maybe don't have anyone else to ask those questions to. So I think you're right. They are such an important part of the village. And it's great to see kind of how we've been able to kind of adapt the work and bring them into it. You spoke a little earlier about kind of the collaboratives, the family service and children's mental health collaboratives. And I know that, the work that we do is not just about, providing information and training to them, but there's also a bigger reach around something that, we call More Resilient Minnesota. Can you talk about More Resilient Minnesota and what is the impact of that?
Absolutely. Yes. And I cut out for a minute. So I think I heard the question. So really, yeah. So More Resilient Minnesota is a really cool initiative that has been supported by children's mental health grants and kind of is built into the base of our state funding. And our contract manager is in the room. So Ann Gaasch, a quick shout out to you for being a part of this whole build of the initiative, which has been probably 10 plus years in the making. But More Resilient Minnesota is an initiative that really supports kind of doing some deeper work alongside children's mental health and family services collaboratives. So kind of starting with this initial awareness of neuroscience or ACEs, addressing ACEs using the ACE interface curriculum. So understanding ACEs, building self-healing communities curriculum. And then so we share that information, and then kind of that similar to that model we talked about with early child care providers, we then train presenters to continue sharing that information within their different sectors. And so, as I mentioned before, collaboratives often will have, many different kind of both mandated partners and then other partners who they kind of bring in who are passionate about supporting children and families within a specific community. And so what we'll do is we'll train, kind of whoever they identify as champions in that community who are interested in sharing this information. We'll train them through this process. And then from there, we really try to bring people together in partnership or working alongside collaboratives to help them kind of bring together their community partners and to hear from those, especially those most impacted by adversity and trauma and historical trauma, to ensure that they have that their voices are included in decision making. And so through this process, we kind of build through, phase one is the awareness of ACEs and the neuroscience information. Phase two is really training and building capacity to sustain this kind of the sharing of the information. Then that third phase is bringing people together or having conversations one-on-one through the 100 cups of coffee model. And then kind of as these collaboratives kind of have this framework that they can use to collect community data, they're also looking at some of their quantitative data, such as their Minnesota student survey data. What are the students saying about their experiences? And kind of bringing all that information together, they can kind of figure out what are some of the biggest themes or needs in our communities, what's working really well that we want to build on, and they can kind of outline a plan. So we have all these different tools that we've created through this process, a community resilience plan that people can fill out to really start driving and directing some of their strategy and focus to address ACEs and really promote protective factors in their communities. So we have all these tools built out. It's taken, years to kind of build out these phases alongside our partners. And we are just really grateful to be doing the work alongside amazing champions across Minnesota. And currently we've had about 70 collaboratives have opted into this process since 2016, I believe. And again, you can fact check me if you want to add anything, but It's just really been a cool way to really support collaborators, not just a training here and then good luck, but really like, here's the awareness, here are these tools to really build towards those self-healing communities, bring people together and ensure that decisions are informed by community partners, especially those most impacted by the issues that we're really trying to work through and resolve. That was very quick. I could talk a lot more, but I'm watching time, so I just want to honor that. And please reach out if you have questions or want to get involved with your local collaborative. I'll put that out there as well.
Thanks, Emily, because I know it's a very deep subject that we're giving you very little time to kind of talk about at a very high level. And I know there's a lot more underneath that. You use the phrase kind of self-healing communities. And you've talked a little bit in some ways about kind of the phases and how that kind of maybe can play into self-healing communities. Is there anything you would add to help people understand it, or any ways you've seen it in action that you'd like to share?
Yeah, I mean, honestly, I would put Lowell on the spot here. So Lowell is one of our partners who we've worked with, who has kind of walked through some of the phases of the S'mores Light Minnesota. He's been trained as a presenter. He's trained, they've trained presenters in their community. They've really brought people together through 100 Cups of Coffee, right? And did the Bold Yet Untold. They kind of created this beautiful book based on getting input from community partners. And I don't want to tell your story, Lowell, because it's yours, but just like your community's example of taking this information, hearing from community members what matters most, highlighting their stories and uplifting those stories of resilience. That is something that provides hope, and it provides kind of direction for future opportunities or actions that your community could take. So that's just one example that I think is just really cool to highlight, that it may kind of ripple out from this process. So I think the thing is, it's not prescriptive. We have these tools, we've built out these opportunities that people can become involved in, and then where communities take it is really exciting. So kind of the self-healing communities is not a prescriptive piece. It's really about how do we shift our cultural norms within our communities to be more responsive to trauma, to be more focused on promoting protective factors, and ensuring that everyone really has this base information. I could say a lot more, but I'm just going to pause because I know we're almost at time.
Thanks, Emily. So we've talked a little bit about a new partnership in Tribal Near, and we've talked a little bit about we've certainly seen an uptick in interest. What excites you the most about kind of where we're moving forward in the Tribal Near, which is kind of taking this model and making sure that it's that we're lifting up and celebrating tribal communities?
Yeah, I'm so excited about this expanded partnership with Peacemaker, because we've already seen kind of a surge of new interest in different tribal communities across the state who are ready to get to kind of start hosting presentations. We've worked some in Lower Sioux. We have 4 presentations coming up in Mille Lacs. We've been invited to the Indigenous Peoples Weekend in St. Paul coming up in October, where we're going to be sharing this information, neuroscience, kind of through a culturally responsive and specific way, which we're really excited about, which is something that's made possible through our partnership with Peacemaker. We were kind of out in Leech Lake last week, kind of connecting with some partners and sharing about the resources through the project. So I just think there's a lot of energy that's been building that we just haven't seen as much energy until in the last few months. People are ready for this information, and we're just so glad that we're able to partner with Peacemaker so we can really kind of expand our reach through the partnership.
Yes, it's very exciting. I want to make sure that I know we're at time, but I do want to give anyone who has a question or a comment a chance to jump in if there's anything. And so I see from Ann that Emily and her team have worked wonders in rolling out More Resilient Minnesota and supporting collaboratives and communities in their journeys. And I would just say back at you, Ann. I mean, we couldn't do it without you and without kind of your wisdom and your leadership. But any other questions that anyone has? Right. And I see your thank you, Marissa, and thank you as well. So I just want to thank everyone for joining today. We hope that you'll come back next time. Things are always moving and advancing rapidly here at FamilyWise. So we're really grateful for all of your partnership and wisdom and support and co-creation. And just want to thank you for your time today. So I hope you have a great afternoon. Thanks again, Emily, for joining. We got to find a way to give you more time. So
Thanks. It was so nice to see you all today. Thanks for having me.
Thank you,
Thanks, everyone.
everyone.